Thank you. Our next presenter is Allison. All ready? Allison fell. I met her at an OTPT conference, and I thought she was fabulous. She works at the Connecticut Children's Hospital, and she's speaking to you today about hands and OT, or occupational therapy. And you got it going? There you go. Look at you. Thank you so much.
So yes, just to kind of explain how I got involved with the CMT is I do work at a center of excellence, and then I got the wonderful invitation from Elizabeth and Gina to go to Phoenix to be with a group of physical therapists and occupational therapists from all over the United States and outside of the United States. And what was so great about that is just being with other therapists who work with individuals with CMT, and since then we've stayed in close contact. Now I have, a handful of people, larger than that even, that I can send an email with any questions I have, and we've met since then. It's interesting when we meet. We've had some teleconferences. I luck out being on the East Coast. It's 5 p.m. for me when we meet. But for others, it's 11 p.m., it's 4 a.m., but everybody gets on the teleconference and we just discuss outcome measures, treatments, and it's just a wonderful group to work with and to stay in contact with. So thank you, Elizabeth, for that invitation. And then she asked me to speak today. So I do work at Connecticut Children's Medical Center. I do work with, all the way from infants up to early 20s. And the presentation I put together should cover the entire age range. And then I just kind of like to ask people in the room how many think they are familiar or could explain what occupational therapy is. Raise a hand. Because I still find it very limited where I go places. People know what physical therapy is, but they don't know what occupational therapy is. So hopefully today, by the time you leave, you will understand the role of occupational therapy and the benefits. The effects of CMT on the hands, which is great. Many of the presentations did talk about the hands and the weakness that we see there. And as OTs, what we really focus on is activities of daily living, and then also looking at treatment strategies and adaptive equipment that's out there. So occupational therapists do work across the entire lifespan, all the way from infants on up. And what our job really is to do is to increase participation throughout your daily living. Any occupation that you want to participate in, that could be what you need to do, go to work, go to school, or the things you like to do, play video games, anything along those lines. So what is an occupation? Like I said, that is work, it's play, it's going to school, it's your self-help skills, you're dressing, you're eating, you're brushing your teeth, toileting, doing your hair. It's also instrumental activities of daily living, so that is cleaning the house, maybe some of the things we don't like to do so much, but cleaning the house, preparing meals, money management, driving, and the use of communication devices, along with leisure and sport activities. And also a big area or occupation we look at is also sleep. So you can find occupational therapists in various areas. You can find them within hospitals, outpatient settings that do include clinics, schools, home care settings, daycare, and community centers. So when might be the time to see an OT? That would be any time that you're finding some of your symptoms are taking away your ability to either participate or participate easily in one of those occupations that we discussed. So a lot of times when I do talk with individuals in some of the surveys that have gone out, what does come back is saying that buttoning is a difficult activity. Picking up or manipulating objects, dropping objects frequently, opening objects such as a water bottle. And for the kids I work with, a lot of times lunchtime is difficult, being able to open those lunch containers, those small snack containers. Writing is also one I hear a lot, either fatigue or hand cramping. Pouring is also can be tricky, and zippering. So OT process usually begins with a physician's order, and then we either see them within a clinic setting or other settings. When I do work within the Center of Excellence, I know discussed early some of the outcome measures. I do the CMT PED scale and also the infant scale that was discussed earlier. And really, as an occupational therapist, I really want to know what are the supports that you have. What are your barriers and what are your interests? Also identifying strengths, weaknesses, or deficits. What is tricky? What is limiting you from performing those occupations? And then what are your goals? What are your concerns? And then we establish a plan of care together. Then as far as treatment, we look at functional activities and exercises, adaptations, assistive devices. How can we modify the environment to make things easier? And we'll also look at splinting options, which we'll talk about a little bit later, and just guidance and education. So something I always stress is, as OTs, we're the expert in our field, but we're not the expert on the individual or the family. So definitely make sure you're working with a therapist who really wants to hear what your concerns are. Why are you there? What is it that you want to make easier? What are your goals? So just to talk a little bit more specifically what an evaluation would look like, or what we're specifically looking at. We're looking at how the individual can move, being an occupational therapist, more over the upper extremities or the arms and the hands. How much can you move those joints? And then if there are deficits, how much can you move objects, grasp objects, manipulate objects within your hand, and release objects. Then our evaluation would continue to look at the type of assistance or the level of assistance that you might need to perform those self-help skills or those ADLs. So dressing, what is difficult with dressing? How much help do you need? How long does it take you? Are you tired after getting yourself dressed? Feeding, eating, grooming and hygiene, which again includes anything from brushing your teeth to showering to toileting, and then sleep. And those, what we call your instrumental activities of daily living, are those ones of preparing meals, money management, taking care of kids, shopping, housework, laundry, and using your phone or computer. The sense of sharp and dull, the sense of movement and position, or that proprioception we discussed earlier, and the impact of possible pain and fatigue. So how does CMT affect the arms and hands? As we discussed earlier too, we know there's a sensory and or motor component in the arms and the hands. Usually the hands become impaired first, and then it might move proximally in that pattern. Also, sometimes if it is a more severe case or later on, there can be some more proximal involvement also. So symptoms that we see that are making these self-help skills or these occupations difficult throughout the day are hand and pinch weakness, decreased fine motor skills, decreased manipulation, decreased ability to grasp or maintain a grasp on an object, impaired sensation, decreased range of motion or joint movement, and pain and fatigue. So we really look at the degree of hand weakness, as this can have a particular impact on your ability to perform activities of daily living throughout your day and impact quality of life. So just one area that I see a lot in the individuals I work with is weakness in the thumb, or the ability to move the thumb away from the hand or oppose objects. So I thought we could just look a little bit more in how many things you actually do that you use your thumb throughout your day. So your thumb does act as a stabilizing force or opposing force to various objects, and you can see all the different types of grasp, from very small objects to a ball to a pencil. And then also manipulating, how can I move coins in my hand if I'm trying to put coins in the parking meter or the vending machine. So these are also a whole bunch of different self-help skills where you would use your thumb. So grasping clothing, how you grasp your sock to pull it up, or your pants, or to hold your shoelaces, to open a doorknob, to put an elastic in your hair, or to put a belt together, or jewelry together, or even within cooking. And then more eating and drinking, we use our thumb, writing, money management. One I see a lot is a lot of the kids I work with are involved in a lot of gaming or want to use their phone. So of course we want to try to have as much thumb ability as we can for those tasks. So then if we get into talking about the different kinds of treatment that are out there, there is remedial, which is the process of restoring or maintaining function. And then there's compensatory methods. So this is when we would look into making adaptations to the environment or bringing in a piece of equipment that might help. Also exercises and activities, adaptations, assistive devices, as I said, modifying the environment, the splinting options that I'm going to talk about a little bit, and guidance and education. So stretching or range of motion. So this is one as therapists, whether OT or PT, we do talk a lot about, and the importance of preventing joint contractures, the hands or the feet becoming stiff and losing range of motion. So daily stretching can maintain that movement of the wrists, the fingers, and the thumbs, and it can reduce cramping, pain, and joint deformity. So there I have some pictures of sometimes what some of the hands look like that we see when we're starting to get some, tightness or decreased range of motion in the hands. So then, of course, strengthening is another thing. Sorry about that. I really skipped ahead. All right. So strengthening is, of course, another thing as a therapist we discuss a lot. And as we've really seen that resistance training or progressive exercises for training of the hand and the wrist muscles is beneficial to improve and maintain strength and decrease muscle atrophy in the hands. And there's two types of muscles we're really looking at. We're looking at the intrinsic or the muscles within the hand, and those are the muscles that help us do those more refined activities of manipulating fine motor skills. And then we're looking at intrinsic, which is the larger forearm muscles that are really helping us to open and close the fingers and the movement of our wrist. And in this picture you can see some atrophy in the hands, and then over here a wrist drop where it's hard to move the wrist up against gravity. So these are just a bunch of different things that are out there, and what's great is not everything has to be purchased out of a medical catalog where they cost more money. Now Amazon is great. A lot of these activities I've just gotten at a local Marshalls or TJ Maxx. The picture down here is Theraputty, which many times if you see a therapist, that's something they will give you and teach you the different exercises to help with grip and pinch strength. And then sometimes the lower one down here, I just use like a chip clip or something that you put on your refrigerator, a magnetic clip, to kind of help with some strengthening activities. For fine motor coordination, dexterity, and hand manipulation, there's also tons and tons of activities out there that you can use to work on picking up, grasping, and releasing. This one up here, of course, is just the medicine balls that you can work on manipulation. Travel Connect 4 I use a lot with the kids I work with, and so we all have to pinch, move the piece into our hand and move it back to our fingers before we're able to take our turn. There's actually, if you see down here, a glove now that's a video game. It's just like kind of like Guitar Hero, but you're actually doing all those functional grasp patterns that you need throughout your day. Manipulating coins, and then there's actually tons of apps out there to work on pinching and isolating finger movements. So there's many, many activities that can work on these fine motor skills. Exercise, we've heard this a lot already today. So exercise, again, as a therapist, we're always promoting exercise. Exercise is important to manage CMT and may help to decrease the complications associated with CMT. So some activities we promote as OTs and PTs is definitely swimming, riding a bike, walking, yoga, Pilates, Tai Chi. There's many adaptive sports opportunities out there, and again, that daily stretching, strengthening, and just changing positions. So splinting. Hand splints assist with stretching and positioning of the hands, fingers, and the thumb in a functional position, and they can delay the development of decreased range of motion and contractures in the thumb, in the fingers, and the wrist. So there's daytime splints and there's nighttime splints. Daytime splints really should assist with function, and they should not be getting in your way of restricting range of motion throughout your day. And examples are a wrist splint, which you can see the black and blue one over there. That is if you do have a wrist that's hard to bring up into extension. It helps you to maintain your wrist there to be more functional throughout the day. Or the pink one here is a thumb splint, which helps that thumb opposed to be able to grasp objects. Then with nighttime splints, this is where you would want to, you're looking for a prolonged stretch throughout the night and to maintain range of motion. So this we really say when you're starting to see any tightness in the hands is an important time to kind of speak with your OT about splints. I also recommend, because sometimes both hands need to be splinted, what I really talk with the individuals I work with is, for comfort and for safety, you can alternate. So you can wear one on your right hand, so you have your left hand free, and then vice versa, so that if you need to use your phone or get up in the middle of the night, it's not as difficult. So there's so much adaptive equipment out there, and like I said, a lot of it is so easy to purchase now than when it used to have to all be out of a medical catalog. So when no longer working on just strengthening a range of motion is helping you to complete your occupations throughout your day, this is where you might want to look into either modifying the environment or finding some devices to help. So there are devices out there to again help with all the occupations from driving to leisure to writing and typing. So I just went ahead and put a few slides on some. Like I said, there's so many out there. But there's different ways to help grip objects if you have some weakness or decreased sensation in your hands that make gripping difficult. These ones up here are called easy holds, and you can see it's like a little universal cuff that just would not make an object slipping out of your hand as easy. A lot of people probably already have these, the pop sockets on your phone, so that your phone is not going to slip out of your hand as easily. The one down here is foam grip tubing. It's very light, it's just foam, and there's various sizes that can go on a toothbrush, to a pen, to a pencil. And then this is called active hands, and you see it's a device that kind of goes over and connects so that again you can maintain your grip on whatever you're using. So adaptive clothing, this is another one that's become so much more accessible out there, and many, many companies are getting on board with making them. So, why do we want to have adaptive clothing? Because getting dressed should be one of the easier tasks of your day. And the adaptive clothing is going to require less dexterity and fine motor coordination. So Tommy Hilfiger has Tommy Adaptive, and this features modified closures and adjustment details so that there's not as many fasteners on your clothing. Under Armour has magnetic zippers, so it doesn't require as much fine motor coordination and dexterity. Target has a line of both adult and children's clothing that are comfortable and they have decreased fasteners on them. Nike Fly Ease is a sneaker that actually a 16-year-old worked with Nike on developing so that it's easier for your braces. And then Myself belt only actually requires one hand, and it's more of a device that clips and then you just pull over with Velcro versus needing as much fine motor coordination. And then these are just some more things, fastener aids out there, just putting a ring on your zipper so that you can actually put a finger in and pull up instead of having to pinch and feel where that zipper is as much. There's all different types of devices out there for shoe tying and also completing zippers and buttons. So as OTs, we also help with solutions as far as energy conservation, joint protection, home modifications, fall prevention, pain reduction modalities, and also stress management and relaxation techniques. This is another thing that's so much easier out there now too to use because again it's just mainstreamed and you can use your Alexa or your phone to control a lot of things within your environment now. So we would look at this if, to decrease the need to use energy possibly or a fall risk possibility to control devices. So there's things that can dim your lights, there's smart outlets where almost anything you plug in you can then control with a device. There's alarm systems, TV, different appliances within your home. So handwriting is another big one that as OTs, and especially me working more with the pediatric population, we work with a lot. And this comes from a lack of muscle dexterity in the fingers and the hands. So just holding a pencil can be difficult. And a lot of times, you know, if the community doesn't understand, the teachers are perceiving as the child being just messy with their handwriting. Also, hand and arm weaknesses can be challenging, so writing quickly can be difficult, or writing for long periods of time can be difficult. Again, there can be cramping, fatigue. So adaptations for that, again, there's voice commands, there's Siri out there, there's voice to text, there's Dictation Dragon, so there's lots of programs where you can speak and it will write for you. Also keyboard options, there's different ways you can program your keyboard. There's something called sticky keys, so instead of having to do like Control, Alt, Delete, you only have to push one and it will do that function for you. You can also adjust the sensitivity to keys, adjust the mouse speed and responsiveness. So there's a lot of different things out there that you can do with that. And also built up handles and various grips to help just holding a pen or a pencil make it easier. And again, a lot of these things are just, everybody's doing it. I mean, when I first became an OT, talking to an electronic device was kind of strange, but now everybody's doing it. So, you know, laptops, iPads, there's so many we can do with those things. And then this is just a picture of a lot of the different things I use with the children that I work with. So a lot of them are just things that are already out there, toys, but just teaching them how they can use it to help their hand strength, their pen strength, their fine motor skills. And just encouraging them to keep using those muscles in their hands to keep them as strong as possible. And I think we're going to do questions at the end, right?
Thank you so much. Thank you so much. So you know very little about hands and CMT. That was an excellent presentation. Thank you, Allison. Okay, come on up. Come on up. This is Lori Lasky, and she is going to talk to us about our USA, one of the partners of the CMTA. Oh, let me see. Gina, could you turn off the Facebook Live?
Oh. Now you tell me to turn off. Before you told me to keep it on.
Well, you're thinking ahead. Thinking